I have been given the task tonight of giving you the ideas and a little bit of the background and the history of how something like Quikrete that you can buy at Home Depot became a dental material, and how a company like Septidont has taken that to another level and been able to make it a product that is much better when we use it for our patients. So that's my task for tonight. I bring you greetings from the University of Minnesota. We're one of the places around that is colder than you guys are here in Chicago. So we'd be happy to ship you some of the cold weather down here though too. Although I have seen some of the photos of Lake Drive with the huge snow drifts and the ice from the lake and everything, and it looks pretty bad. All right, there we go. All right, so we are going to talk about all of the technology that I'm going to talk about and how this went from Portland cement to these great products that we're talking about tonight. It's going to be Biodentin and BioRoot. The chemistry is relatively similar. There's a few subtle differences, but when you think about one, you think about the other one, and you put it together, then you don't have to be confused about which one works which way and which one works another way. So remember, as we go through this, we're going to be talking about the processes that make these products great, and it goes together hand in hand. So let's talk a little bit about cement, more importantly, Portland cement, and how it got to dentistry. The ancient Egyptians and the Romans and a lot of those people were using these calcium hydroxide cements that they were able to mix with other materials and create buildings. And that's how they did it. And then it was in 1824 that Joseph Aspdin invented Portland cement. We'll talk a little bit more about Portland cement because it's the beginning of everything. It basically consists of some hydraulic calcium silicates and other maybe less pure items in there. And we're going to show you how Septidont gets rid of many of those to make the product that you have better than using Portland cement. Although I have seen in the endodontic journals, this maybe is before your time, because when they first started using MTA in the endodontic world, there were articles that were asking, should we use just Portland cement, which we can go to the hardware store and buy a 50-pound bag for $9 and use that in third world countries. And there were a lot of ethical discussions about those sorts of things. And I don't think anybody's using Quikrete to treat endo lesions. But there it is, Quikrete. What is in Quikrete? Quikrete is tricalcium silicates, dicalcium silicates, tricalcium aluminates, and tetracalcium aluminoferrate. And it's these guys that really take down the properties of Portland cement. So when you look back into the literature and try to find out when did somebody start thinking about using Portland cement to treat dental, and it just happened to be in 1878 in a German quarterly and it was this Whitty who used Portland cement to treat endodontic lesions. And he wrote a case report here. And they found that it was biocompatible and that the hydraulic mechanism of setting was beneficial because it helped them to seal better. And it was very attractive in dentistry, again, because you could have the moisture and it would still set. So as early as in the 1800s, we knew about this, and then it became more modified and was released as MTA in 1998 by Mahmoud Turbinejad at Loma Linda. And he got a patent for that. and it became ProRoot MTA by Tulsa Dental Products in Oklahoma. They were using it for pulp caps, endodontic repairs, and things like that. MTA brought a new era to endodontics and to general dentistry too, because there were some things that could be some resorption cases that could be treated, and it was good because it was biocompatible, like we were talking about earlier, and it had bioactivity, which we were talking about earlier. But it also had some not so good things, and those not so good things were the long set times, and that it became brittle with less than adequate hardness, and it stained teeth, and people didn't like mixing it. And those were all due to those extra components from the Portland cement that were not purified out of there. And so the answer and the solution was Septidon's ABS technology. And this was designed in order to correct some of the shortcomings of MTA. And what did Septidon do in order to make it better? They sped up the set times. They created good hermetically sealed restorations. They increased the hardness to compare with dentin, which again beat MTA. And they minimized tooth staining, and they improved the handling characteristics while maintaining the biocompatibility and the bioactivity. So it became another step up the ladder from what MTA was. So let's talk a little bit quickly about biocompatibility. This is just some cells in culture that have been treated with or exposed to a control on the far left, biodentin in the middle, and MTA on the far right. And it was, and you can see that the biodentin cells maintain more cell numbers than MTA. Not as many as the control, but they found that it was not cytotoxic. So that's just a little bit of a visual look at what the biocompatibility looks like. This is one of the things that I talk to a lot of dentists who like to use products like Theracal for doing pulp caps. And they like to use it because it's very simple. You can just inject it on there, light cure it, and boom, it's a very easy thing to do. But the problem is things like Theracal are very cytotoxic, so they don't protect the pulp like these products do. And bioactivity. Bioactivity, by its most basic definition, means that a material has some kind of a biological effect on surrounding tissues. I think about it like if my neighbor's dog came over to my yard and dug a bunch of holes in my yard, in the grass, in the backyard, I would want to fix that because sometimes, especially in the summer, not in the winter, I like to walk around in the backyard after dark, and I don't want to step in one of those holes and turn my ankle, so I want to fix those holes. Now, I can fill those holes with anything. I can put Quikrete in them. I can put marshmallows in them, and I can still step on those things. But if I really want that thing to look good and to kind of integrate with everything there, I'm going to use some dirt and some grass seed or some sod. And that, to me, is kind of like a bioactivity situation that you get with Biodent and BioRoot. It becomes part of the natural anatomy, and the repair is much better. So that's kind of how I look at it. It's a nice, simplified way to look at it. And it also, stimulates cytokine releases. And we're going to talk a little bit more about that in a couple of minutes. And it just allows the body to kind of protect the teeth, because if we want to really look at it, we should be protecting every tooth we can. Every pulp that we can save is great. Endodontics can get a lot of people out of pain, and when they need an endodontist, they need an endodontist. But many times, general dentists and endodontists can save pulps, and patients can be much better off. So vital pulp therapy is a very important thing for us to know more. It's a little beyond the scope of what we're doing tonight, but But here's how Biodentin and BioRoot will actually work. With Biodentin, if you were going to use it to pulp cap, it releases as a part of its bioactivity ions, and those ions will help mineralization. It will help hydroxyapatite formation, induction of pulp and periodontal cell differentiation, and that high alkalinity that Lauren talked about that is bactericidal. They also will stimulate cytokine release, transforming growth factor beta 1 angiogenesis. You can get blood flow into tissues that need blood flow to repair themselves, and it creates a hermetic seal around the repair. And we don't have enough time to go through all of this stuff. I just put this in here to show you all of the things that are going on with Biodentin. When you put Biodentin next to a pulp, there's a lot of things that stimulates inside that pulp tissue, and in order for that pulp to heal and to create or to continue to have a pulp that's alive. And so it gives it the best chance to survive. So this is just a cartoon of the protein transforming growth factor beta 1, which is stimulated to be released by pulp cells when you put Biodentin on an exposed pulp, and it works by controlling cell growth, cell proliferation, cell differentiation, and apoptosis. So it really helps that pulp to come back from a dire situation. So let's compare MTA and Biodentin side by side. We would look at manipulation. Biodentin wins. We look at setting time. Biodentin wins. MTA is at 70 to 175 minutes for a set, and Biodentin is at 10 to 12. You look at the compressive strength. Biodentin wins. And you look at the mechanical resistance. Biodentin wins. So lined up side by side, Biodentin consistently wins over MTA, and I don't use MTA anymore in my practice at all. So this is what, again, we're here to talk about tonight, is these newer products or upgrades to great products, and we're making better products even better. And that should excite all of us, because we have a great job, and the things that we do to repair teeth is important. It's important to our patients, and the best things that we can do is give them the best treatment that's available. And that's why using materials like this is so important in your practices, whether they're expensive or whether they're not expensive. If they allow you to be the best dentist that you can, that's an intangible that you can never really refuse. So, Septodont improved the set time. They went from that 170 minutes for MTA to 10 to 12 minutes for Biodentin. And they have special properties of their materials that allow that set, and continually working on improving the set times. And so they're not satisfied with where it is. Septodont is working hard to even make things better for us and make it easier for us to work with our patients. This is just a little look at how the setting stages of Biodentin, and this is how it resists micro leakage. When you have the dry powder and then you add the liquid, you get this gel that precipitates on the surface of all of the particles. And that gel basically fills in all the voids, and it creates that early hermetic seal, and it allows the biodentin to be sealing, because anytime we're working in the mouth, we're working in a microbial factory, and we need to protect that tissue right away. And this protects it right away. And then as things go on, you can see in this picture, hydroxyapatite crystals have started to form against the biodentin, and that is at the interface between the biodentin and the dentin of the tooth, and those hydroxyapatite crystals actually start to grow into the dentinal tubules and seals it even more and allows a hermetic seal long term. So you get the gel short term, and you get the hydroxyapatite for long term sealing, hermetically sealing these lesions or trauma cases. So how did they get the compressive strength? Well, I'm not a metal person or even a materials person, but these graphs really show it all. So if these graphs show the hardness, and the tricalcium silicate curve is this one, and that's the highest hardness. And some of the Portland cement type products have all these other components in them because they aren't as pure as biodentin. And so you can see if when Septidont can eliminate these other components of the old Portland cement, that it allows the material to have a much higher hardness. And that corresponds to this. That when you look at MTA, the hardness of MTA, it stays down here. Glass ionomer is the yellow, and biodentin is the red. And it will actually get to approach or surpass the hardness of dentin. And MTA cannot hold a candle to that because of the technology that Septidont has to purify these materials. Tooth staining. Lauren talked about tooth staining. We can save a pulp, but I can tell you that a lot of moms would come to me and say, I don't think this is a great result. And how do we fix this? Because this is not something I want for my child. And so we need to be able to give treatments that don't make things worse in the parent's eyes because they're paying the bill. So Septidont has taken the staining that is more inherent with MTA, and it removed it from their product. So let's recap. Hardness, ABS works, it wins. Ion release, ABS wins. The alkaline pH, ABS wins. The hydroxyapatite, ABS wins. Bioactivity, at least equal to or winning with MTA. Let's recap a little bit more. Equal or better than MTA with biocompatibility, bioactivity. Clearly better than MTA in handling, and it's even getting better, as you're finding out tonight. And a significantly faster set with work ongoing to make it even better for us. Hermetic seal, better compressive strength, less staining. All things that are important to restorative dentists, endodontists, all dentists. So where can you use it? You can use it in a number of different things. You can use it in caries, dentin caries treatment, pulp exposures, pulpotomies, perforations, internal and external resorptions, apical surgeries, apexification. So there are a lot of uses for this material. In our hospital clinic at the university, we always have biodentin, we have BioRoot, and I have not used BioRoot Flow yet, but I'm excited to use it when I get back Monday. And I will be using it because this is what I've been waiting for. I don't mind mixing it because it works fine. And I'm not an endodontist, so I'm not doing endo all day. But I'm looking forward to using the BioRoot Flow. Biodentin is a huge part of our practice because we cover the emergency rooms for a big, huge metropolitan hospital. and we have 53,000 students at the University of Minnesota. And when you have alcohol and testosterone together, the best decisions aren't always made. So we get a lot of patients that have broken teeth, knocked out teeth. We get cases where somebody comes in to the emergency room and says, oh yeah, you know, I found my tooth in my pocket this morning. And when did you get it? Well, let's see, I think it was like last night or the night before. I'm not 100% sure. So, you know, so we do treat a lot of trauma, a lot of different types of trauma, and we rely on these products. And our residents go out and they buy these products when they leave us, and so that's a great testimonial to the benefits that we see from using these products. So just a quick case. I am a wet fingered dentist. I don't sit and research all the time or anything. This was one of our emergency room cases. A guy was out for a jog, tripped over a crack in the sidewalk, knocked his incisal edge off, and so isolation. We're doing a spec type pulpotomy here. We're making a prep with a new diamond, and there's the prep, and the fragment we're just soaking to keep it moist. The biodentin in place here, and then we've bonded the fragment back on to this case. And the prognosis for this is excellent. And we've done a service to this guy because he doesn't lose his pulp, and there's a great chance that he won't lose his pulp unless he trips over the sidewalk again. So thank you for that. Again, I like to know how things work, so things like this make me excited. I've been to too many CE courses where I hear some dentists go, I don't even want to know how this works. I just want to know how to do it. So don't be like that. And thank you for listening, and learn how things work and use them to the best abilities of your practice and to protect your patients. Thanks.